Depression isn't a bad mood. It's a complex shift in brain chemistry and stress mechanisms. In this episode, we'll step into the scientific darkness behind the feeling, exploring how it forms and why it holds on so tightly. Give me a minute of focus, and you might discover that understanding depression is the first step to loosening its grip on the mind. Andrew Solomon, a psychologist at Columbia University, wrote in his book, The Noonday Demon, that depression is rude. The evil spirits and ghosts come to you at night, in darkness, in witnessing their defeat. But depression, it comes at very noon. It strikes when you are fully awake, fully aware, when you know exactly who you are. That's what makes it cruel. He talks about something called psychomotor retardation, where the depressed person moves slowly, thinks slowly, almost frozen. These symptoms, along with others, make depression one of the leading causes of disability in the world. When we hear disability, we imagine physical wounds, war injuries, cancer, but according to the World Health Organization, by 2025, depression will be the second leading cause of disability globally. In America, among young people, it's already number one. Statistics show that depression steals more years of human life than war, cancer, and AIDS combined. A depressed person often feels a deep, irrational fear of everything and nothing at once. Freud once said that pleasure is simply the release of tension. Think about the tension when you really need to use the bathroom. The unbearable pressure before relief. That moment of release brings pleasure. Now, imagine living with that tension forever, with no release. That's depression. Fear without an event. Tension with no end. After some time, many patients develop what's known as agitated depression. Violent feelings of hate, guilt, and self-loathing. The tension makes them sleepless. Lack of sleep worsens the anger. Anger destroys their work, their relationships. They push people away, lose everything, and eventually they start thinking about suicide. Neuroscientist Robert Sapolsky from Stanford University calls depression the worst disease of all. He says, if you ask someone with cancer or heart disease, they'll tell you they suffer, but they can still find joy in friends, in faith, in love. Depression, however, kills the ability to feel joy. That's called anhedonia, the inability to experience pleasure. Nothing makes you happy. Not a film, not success, not family, not friends. The painter Gerald Richard once said, "I know nothing. I can do nothing. I understand nothing. And the worst part is, all that misery doesn't even make me sad." That's the horror of it. The loss of sadness itself. Sadness, believe it or not, is a blessing. Without it, you can't love, you can't care. Despair, in a way, fuels love. Depression is not just feeling down. It's a disease, and it comes in degrees. Mild, moderate, or deadly. It can be environmental, caused by trauma or relationships. It can be genetic, passed down through families. It is biological, not just in your head. Spirituality, friends, and fresh air may help, but they don't cure it, because it's an organic illness, one that changes brain chemistry. There are medical criteria to diagnose it. If for more than 2 weeks you can't sleep or sleep too much, lose interest in things you usually enjoy, feel worthless or want to hurt yourself, that's clinical depression. A Lancet study in 2017 estimated over 136 million people worldwide were affected. In France, 21%, 1 in 5, have experienced depression. Women are more likely to suffer for both biological and social reasons. Think about it. Pregnancy, childbirth, menstrual pain, lower pay, fewer job opportunities, higher risk of assault or domestic violence. And biologically, women produce less serotonin, which increases risk. When a depressed woman becomes a mother, her depression can transfer to her baby. Symptoms appear in infants as young as 3 months old. They turn their faces away, even from their mothers. They'd rather look at the wall than at a sad face. A depressed mother can't show tenderness. She can't set boundaries. She can't love properly. She swings between anger and guilt, smothering affection one moment, emotional distance the next. But when the mother is treated, the child's depression often disappears too. Studies also show that highly intelligent and successful people are more prone to depression and anxiety. Among members of Mensa, the Society for the Top 2% in IQ, 26% have mood disorders and 20% have anxiety disorders, twice the average. Perhaps it's because their minds are always racing, always alert, always analysing, always bracing for disaster. Even great minds like Winston Churchill wrote about their depression. But men, in particular, face a silent epidemic. Officially, women are twice as likely to be depressed. But many scientists believe men's rates are just as high. They just don't talk about it. Why? Because it's shameful for men to cry, to fear, to seem weak. A man might be terrified of taking a shower, paralyzed on his bed, dependent on his family, yet unable to admit it. Women's depression grows because they're not happy enough. Men's depression grows because they're not brave enough and not allowed to be weak. And that repression turns many men into ticking bombs. Their pain erupts as violence against others or against themselves. Even though women are twice as likely to be depressed, men are 4 times more likely to die by suicide. Depression in men often ends in tragedy. My favourite painting is Not to be Reproduced by René Magritte. A man stands before a mirror, but his face is turned away. He sees everything reflected except himself. It reminds me of Joel P. Smith, a patient who survived multiple suicide attempts. He said, "I'm lonely. Many of my depressed friends are lonely. After losing jobs, draining their friends and families, I've become more suicidal. My last guard, which was myself, has stopped protecting me. And worse, he has become the one trying to destroy me." That's what depression does. It makes your own mind betray you. We can understand when nature betrays us. Earthquakes, floods. We can understand human betrayal, lies, theft, murder. We can even understand the body turning against itself, cancer, autoimmune disease. But when the mind turns against you, that's the deepest pain. After depression, you lose track of who you are. You can't tell which voice is yours and which one belongs to the illness. Who's me? Who's the fear? Who's the disease? Depression is not drama. It's not weakness. It's a medical illness, and it's treatable. Therapy helps you understand and reframe your thoughts. Medication works for more than 50% of cases, sometimes dramatically. People who were ready to give up come back to life within weeks. Many fear medication, think it's addictive. It's not. It's effective, and it can save lives. Alongside treatment, exercise, good nutrition, and healthy relationships help a lot. If you're struggling, please seek help. And if you know someone struggling, help them reach a professional. Finally, as Andrew Solomon says from his own experience, the opposite of depression is not happiness, it's meaning.